Hi everyone, we're Lily, Addie, and Marissa, and today we'll be presenting on skin cancer, one of the most common yet preventable cancers in the world.
We chose this topic because skin cancer affects 1 in 5 Americans in their lifetime. It's something that can happen to anyone regardless of their age or background, and learning how to detect and prevent it can save lives.
We'll go over what skin cancer is, the different types, signs and causes, and how it affects the bodies, and ways to prevent it and treat it.
What is skin cancer? Skin cancer is a cancer that starts a cell growth on the skin that invades and destroys body tissue. Skin cancer starts when skin cells develop changes in their DNA, normally caused by UV rays from the sun or tanning beds. Instead of dying off like normal cells, the damaged cells keep multiplying. This is from DNA patterns changing, and it causes the cancer cells to keep thriving. When skin cancer spreads, it's known as metastatic cancer, which is when it becomes the most dangerous. You can tell when you have skin cancer because it shows up as a bump, growth, or patch on the skin, and it can be detected by the change in shape, size, or color of these growths.
Types of skin cancer. The most common types of skin cancer include basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal cell carcinoma is the most common type of skin cancer. It originates in basal cells. It looks like a flesh-colored bump or a pinkish patch of skin that grows slowly. Early treatment and diagnosis is important for this type of cancer. It is caused by a consistent exposure to the sun or indoor tanning. Squamous cell carcinoma is the second most common type of skin cancer. It develops in squamous cells. It looks like a red bump with a firm feeling, can be a scaly patch or sore that opens and reopens. It tends to form on skin that is most often exposed to the sun, like ears, scalp, neck, and legs. Melanoma is the deadliest form of skin cancer and originates from melanocytes. It can develop as a mole or can pop up as a new dark spot on the skin. It is caused by exposure to the sun. It can spread to other parts of the body if not treated quickly. Early diagnosis and treatment is super important with this type of cancer.
Signs and symptoms: a new mole that changes in size, shape, or that bleeds, areas on your skin that looks like a scar, sores that have crust or depression in the middle or bleed often, a wound or sore that will not heal or heals but keeps coming back again, or a pearly, waxy bump on your face. One of the best tools we have against skin cancer is paying attention to our own skin. Watch for moles or spots that change over time and constantly paying attention.
Causes of skin cancer. The biggest cause of skin cancer is UV radiation from the sun or tanning beds. Skin cancer is contracted from extreme sunburns or blistering, as seen in the picture. It's kind of hard to see, but below the chin there's bubbling, and that's just a sign of extreme burn, which leads to cancer. Most skin cancers are also found on parts of the body with the most sun exposure. This is because UV rays change and damage the DNA inside of your skin cells, resulting in cancerous cells. Some cases, however, develop without sun exposure, especially in people with a family history of skin cancers, or also with people with weakened immune systems. Again, knowing your family history can increase the prevention of your chances of containing skin cancer.
Effects. Metastasis is one of the biggest dangers when cancer spreads from the skin to the other parts of the body, like the lymph nodes or the lungs. The immune system. People who have weaker immune systems have a higher risk of developing more aggressive skin cancers. Genetic alterations. Because of UV damage, mutations are critical and genes can occur like TP53. The effects aren't just physical, they can also affect confidence, appearance, and emotional health, especially when visible areas like the face are involved.
Preventions of skin cancer. The good news is skin cancer is one of the most preventable cancers. One thing you can do to prevent cancer is wear sunscreen and cover up when outside to protect yourself from the harmful UV rays. That is the biggest leading cause of skin cancer, so that's the most important prevention. Another thing you can do is check your skin regularly for any new spots or growths that you notice that change in color, size, shape, etc. One way you could do this is by regularly seeing your dermatologist and having skin checks with them. Also, just having self-awareness. If you're redheaded, blonde, fair skin, or like freckled skin, understand you're at a higher risk of skin cancer and should take extra precautions because of the lack of melanin in your skin. Again, self-checks are probably one of the main ways that you can prevent skin cancer or stop it, as well as wearing sunscreen to protect yourself from the harmful UV rays.
Treatments. Treatment depends on the type and stage of the skin cancer. These treatments include cryotherapy, excisional therapy, and Mohs surgery. Cryotherapy freezes and destroys abnormal tissue using liquid nitrogen and good for small, early cancers. Excisional surgery, the surgeon removes the tissue and the tumor plus some surrounding healthy tissue to ensure all cancer cells are gone. Mohs surgery, used for areas like the face where precision matters. The doctor removes a thin layer of tissue and examines each one until no cancer remains. For advanced cases, treatments may include radiation, chemotherapy, or targeted responses. The key takeaway is early detection, and the earlier it's found, the simpler and more effective the treatment will be.
Epidemiology and statistics. Skin cancer is the most common type of cancer in the United States. 1 out of 5 people are diagnosed with skin cancer. There are 9,500 cases diagnosed daily. Melanoma is the deadliest form of skin cancer. It is projected to be the 5th most diagnosed cancer for men and women in 2025. Fair color and Caucasian individuals have a higher risk of being diagnosed with melanoma due to them having a less amount of melanin in their body, resulting in less UV protection. Black individuals only contain 1 to 2% of melanoma cases. Melanoma is more common for women before age 50, but more likely for men after age 50. Most common cancer diagnoses are given between age 19 through 39. The highest case of cancers are in Australia and New Zealand due to their high UV rates in their population containing majority fair-skinned individuals. If melanoma is caught early and treated, there is a 93.3% survival rate. But if not caught early, the rate decreases significantly. Non-melanoma skin cancer is currently rising in diagnoses.
And these are our sources. We use the Mayo Clinic, Cleveland Clinic, and American Academy of Dermatology to provide our research for this project. And we hope y'all enjoyed this presentation. And I hope it reminds everyone to protect their skin and take early detection seriously.
And wear sunscreen!